To health matters now, the Kaduna state government has alerted citizens in the state of the outbreak of diphtheria in Kafanchan, Jema'a local government area. This was contained in a statement released by the press secretary to the Kaduna state governor, Muhammed Lawal. Now, Governor Uba Sani directed the Ministry of Health to send an emergency team to investigate the cases and implement immediate measures. Medical authorities have moved affected individuals to hospitals, including active case searches, contact tracing, and community sensitization. TVC News gathered that the number of children in the isolation ward has significantly increased from 5 to 17 in one day, indicating a rapid spread of the outbreak. Residents have been advised to take preventive measures and report any suspected cases. And I have joining me now the medical director of Sir Patrick Ibrahim Yakowa Memorial Hospital, Kafanchan, Dr. Isaac Nathaniel. Dr. Nathaniel, it's good to have you join me right now. It's quite heartbreaking to hear of the increase in the level of the infection of diphtheria amongst children. Now, can you make us understand how critical this is and what's really on ground there where you are?
Yeah, thank you so much for this opportunity. We were alerted of an epidemic of respiratory tract infection in Kafanchan community, in which most of the victims were children between the age of 2 and 16. And we're told that most of them could not eat. A significant proportion of them present with symptoms such as headache, fever, generalized body pains, weakness, and failure to be able to eat. And there were also rumors that there were deaths recorded, but we've not had any death in hospital. So we sent a fact-finding mission involving medical personnel, medical doctors, and laboratory scientists to go and find out what the trouble was. And they discovered that it was actually a respiratory tract infection that is plaguing the children. So a significant proportion of them have been moved to the hospital with ambulances, and they are receiving treatment.
All right, let's start from the issue of level of awareness. There is the notion that people are not very aware of the preventive measures against diphtheria, or even what the disease is in the first instance. Can you share that with us? How knowledgeable are the people at this time?
Yes, there is no significant awareness, but we are trying to sensitize the community and the surrounding communities on the need to be careful, on the need to use face masks, since it's a respiratory tract infection. And also, they should be careful on touching things carelessly, the need to wash their hands. Basically, all the preventive strategies for COVID-19 is part of what we are encouraging among the community, and we're not having challenge. Then also the issue of distancing among they shouldn't come too close to children who are very, very sick, because we believe that it may be part of the pathway through which those infections occur. So we've sensitized them significantly.
Mm. All right. What are the visible symptoms of this diphtheria for people to get to know that when you see this, this could likely be an indication that it could be diphtheria?
Actually, the laboratory diagnosis is yet to come out. We've not received the result yet. We're still waiting. So we don't know if it is diphtheria or a viral illness. Samples have been collected and sent. though the common symptoms that the patients present with include fever, headache, generalized body pains, swelling of the neck, difficult swallowing. Those are the common symptoms that the patients present with.
All right, could you share with us, because following this outbreak that we are receiving, the report, what is the response of the state government so far to this?
The response has been fantastic. Immediately, I was notified within hours, within an hour or so, I made arrangements for the staffs in my hospital to go to the community, identify those who are infected, and we're able to get samples from them. Then we notified the epidemiologic units in the state capital of the problem we are having. And in less than 24 hours, they sent a team down to our hospital to assist us. So by virtue of all the we've been able to contain the problem on ground, and we've not been overwhelmed currently.
Okay. Dr. Isaac Nathaniel, Medical Director of Sir Patrick Ibrahim Yakowa Memorial Hospital in Kafanchan. Thank you very much for speaking to us from Kaduna State.
Thank you so much.